I want to talk you through the 5 most common intimacy challenges that I work with. Not because I want to pathologize relationships, but because I want to see you as you see yourself in some of these situations, and then you don't feel alone. So problem number 1 is mismatched desire. One partner wants sex significantly more than the other. The higher drive partner feels rejected. The lower drive partner feels pressured and guilty. That cycle makes desire worse for both people. The root cause is almost never a character flaw in either person. It's almost always some unexamined differences in how desire works for both people. And then it's combined with a communication gap. Problem number 2, the sexless periods. Many couples go through extended periods, months, sometimes years, without sexual intimacy. The longer it goes, the more weight it accumulates, and it becomes harder to break the silence. It's harder to initiate without feeling like it's a big moment, and it's actually a little bit harder to be vulnerable. The relationship actually can survive this, and what it cannot survive is refusing to address what's underneath all of it. Problem number 3, sex as obligation. When one partner consistently has sex out of duty rather than desire, the intimacy becomes hollow for both people. The one performing it feels resentment. The one receiving it often senses the disconnection, even if they don't say anything about it. This pattern, if unaddressed, erodes the foundation of the relationship. Problem number 4, intimacy after infidelity. Rebuilding physical and emotional intimacy after betrayal is one of the most nuanced and demanding processes a couple can undergo. The betrayed partner has a nervous system that's in a state of chronic threat detection, like fight, flight, freeze. Even when they choose to stay in the relationship, even when they want to rebuild, their body may not cooperate with them. This is not a sign that healing is impossible. It's a sign that it needs to be approached carefully and in the right order. Problem number 5, trauma and intimacy. Past sexual, emotional, or physical trauma can create disconnection between a person's conscious desire to be intimate and their body's involuntary responses. It triggers the fight, flight, freeze responses, as I mentioned before. And so there's difficulty being present. And these are not character flaws. These are survival mechanisms, and they can actually be addressed with the right support.